One of the tricky things about doing big cases in dentistry is starting, right? You can go to these courses and learn everything, and you can even practice it on models or patients for like a week or 2 weeks. But then you go back to your office and you have your patients who are expecting you to do things perfectly, and you should be, right? You shouldn't be experimenting on anyone unless they know about it and it's in an appropriate setting. But it gets dentists in a weird position where they have this information, they want to apply it, they want to start doing these cases, but you can't do the cases until you've had enough experience, and you can't get enough experience unless you do the cases. So I'll go through the main two, which are veneers and larger surgeries, and let you in on a little tip that I learned a long time ago that really helps growing your skill set in a safe, responsible, patient-friendly way. So we'll start with veneers. So veneers, there's 3 crucial things that you can't mess up on, or that you can't undo or try again, right? So for impressions, for example, if you're doing your first big case, it's not ideal to do 10 impressions, but you can. So for that kind of thing, you obviously still need to know what you're doing, but it doesn't need to be quite as polished for your first cases. The 3 things that are irreversible, or not necessarily irreversible, but should be done properly the first time, even if you're doing your first big case, are your preps, the actual cementation, getting them in the right spot and making sure they stay there, and then your occlusion. Occlusion is kind of like impressions, where you can keep adjusting it and changing it over time, but you really don't want to be doing that. You want to get it right the first time so that you're avoiding pain, things breaking, not knowing what you're missing, right? Occlusion's one of those ones where an impression, you can take it and you know it's poor. If you can't get the right occlusion, you're probably not able to see that it's the wrong occlusion. And so this tip is basically practice how you're going to play, right? The way you practice is the way you're going to play. So you want to specifically practice those key features on your real patients. So for preps, it's easy, right? Whenever you're doing a crown prep, treat it like a veneer first. So if you're just doing a normal crown on number 4, prep that crown like a veneer. And I do mean start to finish. Get that tooth to be a perfect veneer prep. Look at it, adjust it, take an extra 10 minutes out of the appointment to make a perfect veneer prep first, and then change it into a crown. What this does, this allows you to practice actual veneer preps on actual patients so that you learn the different steps of it, you get it comfortable with it in your hands, and you get faster at it so that when this big case comes, it's not the first time you've prepped veneers. You've prepped veneers every day for the last year because you've been doing it before your crown prep. This works because it gives you the actual experience, and it's better for the patient, right? You're giving them a perfect buccal prep, probably a little nicer than you would have done if you were just giving them their crown. And then for cementation, this is something that I tell all my associates, is to seat your regular crowns like your veneers. Use the same cement, use the same techniques, use lithium disilicate or feldspathic, whatever you want to use. Those two are going to bond the same, so it doesn't really matter for your crowns. And make sure you're practicing it with your regular seat. The first office I bought, there was a cosmetic dentist who I bought it from, and he still, when he was retiring, was so nervous about the cementation appointment because everything can go wrong in such a short amount of time, right? Things can go wrong at every appointment, but you kind of slowly see them going wrong or getting worse or knowing that everything's looking good. When you're cementing veneers, especially a full mouth, everything's in there, everything's fine, everything's changeable, and then within 3 seconds, everything is permanent. So you've got one go at it to make it perfect. And so you want to be very comfortable doing this. And so I seat every onlay, every inlay, every porcelain filling, every crown with the exact same cement that I use for veneers. And so when I'm seating my veneers, it's no big deal because I've been doing this 4 or 5 times a day, every day of my life. And so how fast the cement dries, how long I need to use the light, how I can feel it on there, weird things that can happen sometimes that ruin that crown. That's an easy change to make when it's one crown. Those mistakes I don't make when I'm doing big cases because those mistakes I made throughout my career with individual crowns, right? And I'm talking about little tiny mistakes like over curing and realizing that you're not going to be able to get that cement off of there. So you spend 30 minutes getting all the cement off. It is much better to over cure one crown than it is to over cure 14 veneers. That 30-minute fix just turned into a 3-hour fix in an appointment that was already supposed to be 3 hours. So those mistakes on the single crown are so much easier to diagnose because you're focused on just one tooth, and it's so much easier to get comfortable with the process. And then for occlusion, obviously you need to know the basics, right? For all of these things, you still need to know the information first. And then for occlusion, practice your occlusion on every patient. Practice putting them in CR. Practice equilibrating. This also does your patients a favor. If they have wear, if they have TMJ, they have tight muscles, headache, when you're learning, don't charge them $1,500 for the equilibration. Just get them in and help them out and look at their bite and adjust it as you can and use the principles that you know you're gonna have to use on your veneers in your everyday practice in a way that's beneficial to your patients. So that you're not using them as guinea pigs, you're only doing things that are actually better for them while getting yourself more comfortable with these more difficult tasks that's hard to get from just learning or models or short hands-on courses. And then for surgery, right, we've got big bone grafts, ridge augmentations, implants, sinus lifts, all of that stuff. You can use the same principle. So from what I see from surgery, when we have like our hands-on courses or when I'm training associates or when I first did it, to me, the biggest roadblock to go past is tissue management and just comfortability with doing the surgery. Because when you're doing something like implants, the technical side of it isn't difficult. A general dentist has better hand control over the drill than an oral surgeon does, right? We use that drill every day, all day, every day, and we can move that drill better than we can run. So the placement of the drill and the angulation is obviously important, but that's a skill that we as general dentists already have a very good control over. It's the nervousness and the tissue management that I've seen to be the biggest holdbacks. And so for surgeries, it's similar to the veneers. You're practicing while doing the patient a favor and in low stakes situations. And so to get better at surgeries, the number one thing in my opinion is getting better at flaps. If you were to do a surgery and you had your boss or the oral surgeon come in and flap everything, sew down the flaps on both sides, and said, do what you're gonna do, I'll close the flap later when you're done, all surgeries would be very, very easy. So it's reflecting the flaps that is nerve-wracking and a little technique sensitive, and then it's properly closing the flaps back up and suturing. That's the part that's unreversible, right? If you're newer to handling bone, you can sit in there for 15 minutes if you need to, repacking the bone several times to get it to where you want. And that kind of thing you'll get better at and you'll improve on over time. But the flap management, making sure you don't tear the flap and making sure you secure the flap properly, that's the part that needs to be done perfectly even the first time that you do it. So practice these with extractions and practice them slowly. So the next time you're extracting a tooth, you should, most of the time, be at least elevating the papilla a little bit, right? Elevating that gingival margin to be able to get a little more leverage on the tooth. So the next time you're doing it, elevate it a little bit more and a little bit more until you have a nice, comfortable little flap. And then the next step is to release that flap, right? So you do a split thickness release. That's the part that you want to be practicing on low risk situations. Release the flap and get them primary closure on their extraction site. You've done them a favor because that is going to heal so perfectly. And if you can't quite get it secured all the way or you have a little tear in your flap, still going to have more closure than it was. and you're not in a position where you need to keep going. If you're doing like a ridge augmentation for the first time, and you're elevating the flap, and you get a little perforation in the gums, you're a little bit screwed because you either have to finish it with a perforation, which isn't ideal, or you have to just close up and you cut them open for no reason because you couldn't do what you set out to do. If you're doing an extraction, for the patient, the end result when they came in is you taking out the tooth and having a huge open wound. And you're gonna get it closed, and even if you do get a perforation, you getting a little bit of closure will hold that membrane and hold that bone in there better than if you didn't. So you're still doing them a favor. You're still doing a better service for them, even with a tiny perforation. And so it gives you that low risk, low stakes situation where you can practice the techniques. Same thing with gum graft. If you're doing an extraction and they don't have a lot of attached gingiva, let them know you're gonna do a gum graft for them for free at the time of the extraction. So you're taking the tooth out, you're already doing a surgery on them, and you get the store-bought tissue, and you do a tissue graft. It'll stay in there, it'll be perfect. If it's not, take it out at the time of surgery and be like, all right, I tried, and try it again next time. But you're not hurting the patient in any way, you're only giving them a benefit. And I've had some associates tell me like, doing that kind of thing is a waste of money, right? I'm not spending the $200 on tissue to give someone a free gum graft. But they would spend $10,000 for a hands-on gum grafting course. When you're doing these things for your patient, if you have a problem with giving them free services, just think of it as CE costs. And instead of spending it for a hands-on lecture where you're gonna do it on a pig or do it on a patient you're never gonna see again, you're doing it in your office and you're doing it to the benefit of one of your own patients. And this works for all other things too. If you can find out a way to practice the key concepts on your patients in a way that can't do them any harm, getting comfortable at all the individual little parts so that every part is a reflex and is simple, then when you get that first big case, you're confident. It's still gonna be nerve-wracking, but everything will go well, right? You'll still be learning things about the big case, but you won't be learning the individual techniques at the same time. And that's how you can really expand your skill set, really become a super GP, do full mouse, whatever you want in a safe, predictable, easy way.